Good morning, everyone. I am Dr. Ravi Kumar, JR AIMS Bhubaneswar. Today, I'm going to talk on effect of phacoemulsification in myopia on OCT measurements, a prospective study.
Sir, unshare and share it again. That will solve the issue.
Okay.
Now, can you share once again?
There is some issue with the slides here.
Dr. Ravi, we can see the first slide.
Yes, sir. Only first slide is being shown. I'm not able to move to the next slide. Just a minute.
Sir, if possible, you can just start talking about whatever is the content of your presentation.
Okay, ma'am. Just
Sir, you are using the different things. So
trying to do it.
your image with your presentation. So remove your image with your presentation. Just close it. This image.
Dr. Ravi, switched off your video.
Okay, sir. Stop video.
Now you can start.
Sir, it's still showing the first slide.
Sir, I think you have shared only one tab in the screen. You need to share your complete window when you want to, go through the slides for the screen sharing. That should solve the issue.
Ekta, do we have any other presenters also?
No, sir. We are done. This is the last presentation for this session.
Can I read it out without showing the slides?
Yes, sir. Yes, sir. Please.
Okay. Sorry for the inconvenience.
I would like to request you kindly to go to your chief observation and the conclusion.
Sir.
Dr. Ravi, please read it out.
Sir, my topic is effect of phacoemulsification in myopia on OCT measurements, a prospective study. I have no any financial interest. So phacoemulsification is a gold standard technique in cataract surgery. Fluidics and ultrasonic energy may produce mechanical effects that cause an inflammatory reaction, hypoxia, and compression on the tissue of the eyeball, which leads to the transient rise in IOP in the early postoperative period. The peak incidence of cystoid macular edema varies between the 4 to 12 weeks after phacoemulsification surgery. And there are conflicting data which exist regarding the influence of myopia on peripapillary retinal nerve fiber layer thickness after phacoemulsification. So the aim of the study was to analyze the changes of macular thickness and peripapillary retinal nerve fiber layer thickness measured by SD-OCT in myopia and age-related cataract patients after uneventful cataract surgery. So it's a prospective study done at AIMS Bhubaneswar. The 30 eyes of 30 patients with myopia were taken into cases, and 30 eyes of age-related cataract were taken as control, who underwent phacoemulsification from January 2019 till December 2019. The exclusion criteria were age below 18 years with ocular pathology like uveitis, corneal opacity, trauma, glaucoma, posterior segment pathologies, and systemic pathologies like diabetes, thyroid disease, and vasculitis were excluded. And patients on immunosuppressive agents were also excluded. Macular parameters, RNFL thickness was measured by SD-OCT. Visual acuity and IOP was measured in all cases preoperatively on the POD 1 day and 1 month. And the data were analyzed with student t-test, and significance was set at p-value of less than 0.05. So coming to the results, on comparing the myopia and the age-related cataract group, the variables which we checked are the age, lens hardness, K1, K2, IOP, and axial length and phaco time with CDE. CDE is the cumulative dissipated energy. So on comparing all these variables into two groups, we found that the age is the only age and Axial length obviously was significantly different among these two groups, in which the senile group were having higher age group. 61.76 was the mean, with the standard deviation of 8.78. Then the macular thickness values post phacoemulsification was also compared between these two groups, and then we found that only nasal outer macular ring thickness and the temporal outer macular ring thickness was statistically significant, and the myopia group were having thickened nasal and temporal outer macular ring macular area. Then comparing the low myopia and the high myopia group, then we found that there is no
Please conclude, sir.
uh,
Please go for the conclusion and
so,
your chief observation.
So the conclusion was like in patients with high and moderate myopia, macular parameters and RNFL measured by SDOCT didn't change significantly 1 month following phacoemulsification after cataract surgery.
So Dr. Ravi, any effect on CMT, central macular thickness?
Sir, no, sir.
Stop.
On POT 1 month, there was no any changes on CMT in my study, sir.
No, not after 1 month, just after one or 2 days.
No, sir, there was no any significant, sir, the mean sir, the mean CMT in myopia group was 248.76 and in senile group was 246.56 with p-value of 0.9.
I would like to request the coordinator to conclude the session because others are waiting.